if you haven't already done so. So I've just got a few slides that we'll go through. Are you happy to?
Yeah.
So you'll be pleased to know, as fine specimens such as yourself, if you're going to look after yourselves, you need to look after your heart. You need to drink alcohol. If you can find someone willing, you need to have intercourse. A Mediterranean diet is good, with tomatoes. Hopefully you've got good genetics. You need to exercise, and you need a relationship with a good proactive GP. So just echoing Peter's sentiments, it is extremely important to act early on any symptoms that you have. And listening to Peter's story, it's probably thanks to his wife actually that the outcome was so good. And wives are often still the driving factor amongst the patients that I see on a regular basis. But being proactive and a good relationship with your GP is important. You still have to drive your own healthcare. There's unfortunately no way that GPs with their busy practices can take complete responsibility for your screening and your health. So you do have to drive your appointments and make sure you're doing everything you can to live as long as possible and end up being a problem to your own children. Can't hear at the back? Okay, I'll speak more loudly if you like.
Bring up the angle.
So something that I see all the time, of course, is prostate cancer. And it is now right up there with bowel cancer. It's still behind lung cancer as the commonest cancer. So for all the men in this room, your lifetime risk of getting a prostate cancer is about 40%. So it's reasonably high. The chance of that prostate cancer being clinically apparent or important is about 9%. So that's fairly similar to breast cancer. Breast cancer is about 1 in 11 for women, so it's fairly similar in terms of the incidence. I think that's a bit different about prostate cancer is that in terms of a cause of death, it is only responsible for about 3% of male deaths. So therefore it's a common cancer that is treatable and potentially curable, but still has a fairly significant rate of mortality, but it's a lot lower than the cardiovascular causes. So the important things to look at for yourselves with prostate cancer, the most important thing is genetics. So you can't really escape your family history. If you've got a father or a brother with prostate cancer, your risk is 2 to 3 times that of the general population. If you have a brother and a father, for example, or 2 first-degree relatives, your risk is about 11 times the general population. So the most important thing, if you've got a family history, you must be screened, and you must be screened probably from the age of 45, perhaps 40. So that it's pretty important. The other things that are common through cardiovascular, through other cancers, of course, are obesity as a risk factor, and that's independent. So if you have the same cancer as some other man and you're overweight versus skinny, even though it's exactly the same type, the same volume, same type of cancer, your outcome will be a lot worse. And you also have a higher incidence of prostate cancer. And along with that, of course, goes your dietary fat intake. So the big question that's through the media all the time is who should be screened, and should we have a screening program for prostate cancer that's like breast cancer? So it's a big controversial issue, and there are high-profile names that get involved, and a lot of the difficulties with prostate cancer come from the side effects of treatment. And those are not insignificant, looking at impotence and incontinence. Now the good thing, I suppose, is we all continue to improve in terms of treatments, and the treatment outcomes are now a lot better for prostate cancer, particularly with surgery. I mean, surgery used to be pretty dire, to be honest, in terms of the outcomes. I was working the other day with an orthopaedic surgeon next to me in the theatre complex, and I said I was about to do a keyhole prostate removal for prostate cancer. He said, "What?" He said, "Surely all you do is what they used to do, just make a cut, guddle around with your hand, rip the prostate out, throw it at the scrub nurse, and say, send this to the lab." And so that's what it used to be like. It used to be terrible, but thankfully it's now extremely precise. And no doubt you've probably heard about the robot up at Ascot. So that and keyhole surgery's improved outcomes tremendously. So should you be screened? Should you be looked at? And the reality is, if you're under 65 and you are screened and diagnosed and treated for localised early prostate cancer, so you catch it early like all these things, you will have your life prolonged. And that has been borne out in a big European study. So you stand a better chance of living longer if you're screened. So why hasn't this been adopted? Well, there's a big study in the States that says there's no benefit. The other reason is we're never going to gain traction as men with this, because we don't have as many, even though it's important and it's frequent and there's a 3% death rate, we don't lose as many years of life as with cervical cancer and breast cancer. So breast cancer kills women in their 20s and 30s. So you lose a long period of life, 60 years, with one patient. Whereas in 2006, there was one man in New Zealand in his 40s that died of prostate cancer, and the rest 50s, mainly 60s and 70s and 80s. So it's never going to be as emotive, because you don't, well, thankfully, don't have young men dying of prostate cancer. The other thing that was important in that study, and this will be up, Warwick's son John's going to go to the meeting in Washington shortly, where they're going to update some of this data, because with all studies they get published too soon, but the updated data will show that you still have to treat 30 men to save one life of prostate cancer, and you have to screen over 1,000. So there's a lot. It's extremely expensive to do for a population, and as we know, this country has no money. Oh, we can borrow it. 300 million a week, isn't it? And as I said, so the side effects of treatment have improved greatly. So my feeling is that in general terms, if you're a healthy man that's going to live 10 years, you should be screened for prostate cancer. We now know which cancers need treatment and how to treat them, and the side effects are dramatically improved. The last chap I did on Friday, I'm sure he won't mind saying, I won't mention who he is. I did a surgery on Friday, and on Saturday morning, he had an erection with his catheter in. So that's removed his prostate on Friday, and he'll be back to normal in 2 weeks. So it's very different to how it used to be. So when you compare it to breast and colon, it's perhaps not quite as effective in terms of screening, but it's not too bad when you look at the numbers. The numbers for breast and colon to save one life are around 780, 800 and 700. So it's not too dissimilar. So probably, one would hope in the next few years, it will be adopted as a screening strategy for New Zealand. But it's controversial. So what should you do about your prostate? What can you do? Can you decrease your risk of getting prostate cancer? It's hard to avoid your genetics. Leaving that aside, if you want to try and be proactive, aspirin probably has a role, curiously, as everyone says it should be in the water. Cardiovascular drugs, statins, also have a role in somehow involved in improving the outcome from prostate cancer. Lycopenes are tomatoes. Unfortunately, there's more lycopenes in tomato sauce than fresh tomatoes, but tomato sauce, of course, contains salt in huge quantities. Multivitamins are bad. So that's a message I wouldn't mind giving you. Multivitamins in general, men's multivitamins are unregulated in the quantity of certain chemicals in the men's multivitamin. So if you're a man and you want to take a multivitamin, take a woman's or a child's multivitamin. Don't take a men's. There's some evidence that the high doses of the things in the men's may actually feed prostate cancer. So they're expensive and they may do you harm. So if you have to take one, take women's or children's, because they're regulated in the content of certain chemicals. And there's a lot of thought about selenium in our soils there's not enough selenium in our soils. So if you want to check that, you can take a toenail clipping off to the lab and they'll analyse it for selenium. Or else you could just take about 3 Brazil nuts a day. And they don't taste too bad. That will boost your selenium levels, and it may have a role in decreasing your chance of getting prostate cancer. Finasteride and dutasteride. Finasteride's propecia, so it's for male pattern baldness, and it probably decreases your chance of getting prostate cancer if you take it. It has some side effects. It makes you more hairy, which some men don't mind. My children tell me I'm the hairiest man alive, so I'm not going to take it. But it probably does prevent prostate cancer. So we're just talking a little bit about cardiovascular disease. I mean, my grandfather had 2 heart attacks and then died of prostate cancer, so my genetics perhaps aren't tremendous. But he was a GP who had ham and eggs for breakfast, ham sandwiches for lunch, whiskey, and then a fairly good dinner. So, and smoked cigarettes. He had a great life, actually. So, even though, so the chance of dying of a cardiovascular cause, so that's hypertensive-related disease, abdominal aortic aneurysm, stroke, heart attack, it's high, much higher than prostate cancer. If you want to worry about something, don't worry about prostate. Worry about your heart and your blood vessels. The rate of death from cardiovascular disease is decreasing, which is good. The things you can do is look at everyone's looked at BMI in the past, but probably the waist circumference is better as a measurement. So waist circumference is very important in terms of looking at your risk for cardiovascular disease. Statins and cholesterol, very important. If you want to target, if you're at a high risk of cardiovascular disease, you want your LDL. Cholesterol comes in two types, LDL and HDL. HDL happy cholesterol, LDL lousy. So you want your LDL at about 1.6, or extremely low, to lower your risk sufficiently. Alcohol, as you probably all know, it's not an excuse to drink too much alcohol. 1 to 2 glasses or 1 to 2 servings of alcohol one night. It's not an open license for 1 to 2 bottles of red wine. It's simply 1 to 2 glasses or servings of alcohol. It doesn't matter what type. It's kind of irrelevant. It probably is not simply limited to red wine. It's alcohol per se. It raises your HDL and it may help in that way, in a few other ways. As I said, blood pressure, obviously. Mediterranean diet is supposedly a good one to look at. Curiously, in terms of a urologist, do I have any role to play in this? Well, probably not. The only time you do is if a man presents with impotence. That's often a presenting symptom of atherosclerosis, hardening of the arteries. So it's one of the things that should trigger a urologist to think about the heart, because we don't often, to be honest, think about the heart too much. Leave that to the anaesthetists. So cholesterol is very important, and Pharmac, so I'm sure you all know, Pharmac's a central funding agency for drugs in New Zealand, and Pharmac are probably responsible for more deaths than just about anyone in New Zealand. Because it really is terrible, unfortunately. They took a very dim view on all the evidence for the cholesterol-lowering drugs, and for a while New Zealand, for a long time, we were funding drugs that weren't lowering cholesterol as well as other drugs. And it's very clear that a 1% decrease in your LDL gives you a 1% reduction in risk. So the lower the lower the better. So for a long time, unfortunately, New Zealand men were subject to the wrong drug, and women. Wrong drug. So thankfully that has improved, but Pharmac, it's all based on cost, of course, but it's a shame. So yeah, cholesterol is extremely important. And the only other thing we haven't mentioned there is soy and flaxseed products are good to supplement in your diet, as again that helps your cholesterol. Colorectal cancer we've kind of touched on. So again the question is, should